Namaste, good morning, good afternoon, good evening, wherever you are. Thank you for joining. I'm Prashant Joshi at Vivekananda Yoga University, the first yoga university outside India doing graduate education research. This is our Distinguished Speaker Series webinar, 10th in its series in 2025. So thank you so much for joining. We have an esteemed speaker. I'll be introducing him in a bit. So let me introduce our speaker and the topic here. So we are so delighted to have Dr. Nick Shroff as a YU faculty, a published author, a philanthropist, a urologist, a cancer surgeon who's done this allopathic, in the allopathic world, the Western medicine world for 4 decades. At the same time, he has kept the holistic angle. He's an experienced registered yoga teacher, and he has been really serving the underserved population as well as a social innovator. So again, a lot to share about him. He's in Plano, Texas. And again, a dear friend and a colleague here at YU. So that's our speaker today, Nick Shroff. And the topic, as I mentioned, is very, very important for all of us. It's about sleep. And the way you get to an awesome sleep experience is when you're learning to do relaxation breathing for enhanced sleep. So that's the topic. It's relevant for all of us as just human beings, actually beings, as well as the clinical practitioners and yoga professionals. So he'll be talking about the yogic traditions, the practices such as various pranayamas, at the same time giving the scientific evidence with the modern medicine angle. And then this is again very real in terms of sufferings that people have from COPD, asthma, allergies, and so many things that impact our sleep. Stress is really a given here. So with all that, it's a very, very relevant topic for all of us. And we are so delighted to have Dr. Nick Shroff here, again, a dear friend and a colleague. So Nick Ji, floor is yours. Thank you for your time.
Thank you. I appreciate that, Prashantji, and for that introduction. And let me just share the slides with you all. Okay, can you all hear me pretty well? Yes? Okay, good. So let's go ahead and start from the very beginning. And basically, we are going to talk about relaxed breathing to enhance sleep. And then a little bit more details about this sleep itself. And this is how we're going to bring the best of the East to the best of the West. Okay, so this is topic is breathe well, sleep well, and live well. Now, this one slide is an exception because there's a lot of things written down here. Most of my slides are images, and these are images so that you can just look at the picture and say what's going on. Okay, so this is an exception because this talks about all the breathing techniques and all that, and I'll show you some pictures that kind of encapsulates all this. So we need to actively pursue stress reduction in order to sleep well. So remember, it is breathe well, sleep well, and live well. So need to decrease the stress reduction. And one of the ways is to take good deep breaths. So deep doesn't mean like that. Deep means deep end of the swimming pool. So it's a diaphragmatic breath, so it's a slow and deep breath. Okay. Then of course, yoga. We talked about yoga all the time, and I've covered that many previous things. But 30 minutes of moderate exercise is enough. At least 30 minutes. Okay. Little bit more is okay, but at least 30 minutes is good. And then, of course, mindfulness and meditation and progressive muscle relaxation. We'll talk a little bit more about yoga nidra and how yoga comes into the sleep picture a little later when we talk about muscle relaxation and visualization. So, like I told you, we got a lot of pictures. So here is the thing. So it's breathe easy and stress less. So here's a gentle reminder. We need to breathe through the nose, and it's a belly breath. Belly breath meaning it's a diaphragmatic breath. And it's not only that the abdomen inflates like a balloon, but even your ribs flay out. So we'll talk about that in a minute. And then we do the breath count, like 4, 7, 8 breathing. We've talked about that before. And mindful breathing. Okay. So this is what is called breathing with visualization. So we are taking something positive with each breath. So the diaphragmatic breathing brings about relaxation and it improves sleep quality. So as you breathe during the day, so you'll breathe during the night. So you can do this anywhere, any day. And it's a deliberate, slow, spacious practice, mindful stretches, which is the most important. And this will directly help your physiological and metabolic process. Okay. So this is why we need to focus your attention on your breath. So remember, breath is automatic. You don't tell yourself to, oh, I got to breathe, during the night when you sleep. It happens automatically, but you can control it. So we need to focus the attention on the breath, settle your mind, and restore the calmness. So here is another pretty picture talking about the diaphragmatic breath. So when you all can do this with me, you just breathe in and your abdomen should distend like a balloon, and then breathe out and you can deflate your abdomen. And this is a slow, quiet, rhythmic breathing. And that will increase your vagal tone. Vagal tone meaning the parasympathetic nervous system. So remember, the diaphragm does 80% of the ventilatory process that is going on, 80%. So we want to emphasize diaphragmatic breathing and how to improve the efficiency of ventilation. This is why so this will maximize the healing potential. At the end of the day, everything is about healing. And this activates the parasympathetic system, which is the vagus nerve primarily. Okay. So for the circulation, there is a heart. Of course, this diaphragmatic movement improves the circulation, but the heart pumps the thing and that helps the blood flow. But for the lymphatic flow, there is no such heart. So what happens is that this diaphragmatic breathing will improve this. So it enhances the conditioning of the diaphragm. This is what happens. All right. This also improves your core muscle stability and all that. Okay. So we'll talk a little bit more as we go along, but I just wanted to show this picture which improves the oxygen and carbon dioxide gas exchange. All right. So this is the whole purpose of this talk, is to bring from restlessness to restfulness. So when you sleep, you need to be restful, not restless. Right. So this is a very simple picture here. The person is lying down and you can see that there's a gentle reminder that you need to breathe through the nose, and it's an abdominal breath. And as you breathe, your belly expands and the air rushes in. And then you breathe out. So the normal elasticity, it's a passive process. Exhalate. When you exhale, it's a passive process. The elasticity pushes the air out. So one of the most important things that you need to do, the whole day you're working, you're doing all kinds of things, but you need to untie the knots of your body and your mind, especially before bedtime. And one of the best ways to do that is to bring this thing with the nasal breathing, abdominal breathing. And this helps to decrease the stress hormones, the cytokines, which we talk about a little bit later. Okay. So one way to do that is when you're doing this lying down, you can do the 4-7-8 breathing. And you all can do this with me. I want you to feel that when you inhale, there is calmness, peace, and ease. And when you exhale, release stress and disease. So it's calmness, peace, and ease, and release stress and disease. That's the way it goes. So you can put your hand on your belly. You all can do this with me. You can put your hand on your belly, breathe through the nose. Okay. Inhale for the count of 4. 2, 3, 4. Hold. 2, 3, 4, 5, 6, 7. And breathe out. 2, 3, 4, 5, 6, 7, 8. And you can continue this cycle, In the interest of time, I'm not going that, but I do this several times just before sleep. In fact, Andrew Weil is the professor of integrative medicine, and he talked about this, that this is the master to self-healing. And he said that if he had to limit his advice to just one thing to live healthier, just one tip, then that would simply be how to breathe correctly. So this is what controlled breathing is. So breathing is crucial to your body's ability to heal and sustain itself. Now, we've talked about some of these things and I've shown some of these slides to some of you, but I've added many more slides and I've also talked about some of the latest things that is going on in modern medicine. The whole purpose is synergy of yoga and pranayama with modern medicine. So there are hundreds of pranayama, but what you need to do to help you to sleep, to help you to relax, and that is the core of this message. Okay, so remember that breath can influence emotions and the nervous system. So that's the reason why we talk about it. In fact, if you're sad, you're mad, you're stressed, you're scared, then just lie down and relax, inflate and deflate your abdomen like a balloon. This activates the parasympathetic nervous system, which we have talked about. Okay? So this is the most important thing, and this will induce the melatonin, which we will talk about a little later, melatonin secretion, which helps for restful sleep. Okay? So this is why you can do this very easily. And so one other important thing is that a physiological sigh. So this is based on some yoga principles that we have talked about before, but modern medicine is talking about this especially. If you want to reduce stress, the number one thing to do is to do this physiological sigh, which, this can happen automatically, but you can also do it voluntarily. So you in through the nose, and then again you inhale through the nose, and then you breathe out with a whoosh sound, so slow breathing out. So it's a long, prolonged exhale. And the reason I'm talking to you about the physiological sigh is not only it reduces the stress and anxiety, but decreases the overthinking. And that's the biggest problem where people cannot sleep. Or if they did sleep, and if they wake up to go to the bathroom, or for whatever reason the dog is, you need to let out the dog, or whatever reason you wake up, then you need to do this kind of physiological sigh and then do the 4-7-8 breathing. And I'll tell you some other things that you can do, and that will help you to not only sleep, the quantity of sleep, but the quality of sleep matters. So this sigh monitors the brain states. So one of the most important things is that you need to understand this is a 2-component burst, and then it is followed by apnea. That means there is no sleep, right? So apnea is that there is no breathing for at least 10 seconds. Okay, so if it is less than 10 seconds, it's called hypopnea, right? So this is an augmented breath. So you take a normal breath, and then you take a big sniff, second breath, and then relax completely and let the lung expand, and then you can breathe again. So this is the augmented breath. It's called the thing. Now, the person who talked about this arousal and how to can reset the breathing variability is Jack Feldman. Jack Feldman is a neuroscientist, and he's a professor of neurobiology at UCLA. Now, he talked primarily about the underlying breathing mechanism and the sigh of relief. So this happens voluntarily and involuntarily. And many times this happens like every 5-10 minutes, it happens automatically. But you can also do it if you're stressed. So this pre-Bodzinger complex that I talked to you about here, so that was discovered by Feldman, Jack Feldman. So he was responsible to talk about he discovered this. This is in the brainstem. That means the medulla oblongata. It's called the medulla oblongata, but it's in the brainstem, the lower part of your brain. And that is responsible for controlling your rhythmic breathing. So I want you to understand this, because if you understand the physiology of this, then you can tie this whole thing down very nicely. So this is an augmented breath. Suffice it to say, it's an augmented breath. It happens instinctively, and spontaneously, especially when you're stressed and anxious. And little kids also do that. If you see a little baby, or even animals do that. But the important thing is that you can do this properly if you want to control the stress. Okay. So too much of sighing can cause problems also. But sighing may be, too much of sighing can be due to underlying health conditions, anxiety, depression, respiratory problems, and all that. But that is too much. But you do need this. And if you do this too much, then sometimes you can faint also because, decreases the blood pressure. This is an important thing, but you need to do it for optimal performance. Okay. All right. So when we talk about all this, what is the big deal? Why are we doing all this? Because you want to create a peaceful inner garden. Remember one thing, this is the quiet time. We need to actively pursue stress reduction, and that needs a peaceful inner garden. So remember, you're in control, and the outside world does not control you. You're not a football to other people's ideas. You need quiet time. You need to address your own thing. So this is why we talk about careful attention, motivation, effort. All of this thing creates a inner garden. You need to cultivate beautiful flowers. These are the positive thoughts. And uproot all the negative thoughts because they're going to strangle the garden's beauty. That's why in yoga we talk about sukha pranayama, the simple yogic breathing techniques. Zen Buddhists do this thing called zazen. You must have heard a meditation practice called zazen. They breathe, to 6 breaths a minute. Slow down your breathing. Dhyana, in the Patanjali Yoga Sutra, they talk about dhyana, dharana. This is all simple methods to correct your breathing. Okay? So while the mind wanders into thoughts, past and present and all that, we need to use this neuroscience to step down. It's called a step down unit. This can be followed by quiet contemplation and relaxation. So this is what I'm talking to you about today, the peaceful inner garden. That's what you need to create. So what is the big deal? If you don't do this, what happens? So what if you don't have enough sleep? Okay. So let me tell you this. Insufficient sleep decreases your metabolic health. So that's why you get diabetes. You can get diabetes, obesity, increase of sympathetic tone, hypertension, heart attack, stroke, decreased concentration. All these things can happen if you have sleep deprivation. Remember, sleep is an active process for almost every organ in your body, including the brain. So we need to have sufficient sleep. One other thing that happens during sleep is called the lymphatics that clear toxic materials. So remember, we talked about the lymphatic system, which takes the fluid from your body, the toxic materials from the body. That is the lymphatic system. So similarly, in the brain, we have a glymphatic system. Glymphatic meaning glial cells. Glial cells are the supporting cells. And they clear out the toxic materials when you sleep. And that's how you can get recharged for the next day. So these are neuroendocrinology problems that we have talked about. And modern day medicine talks especially about this. Remember, if you don't sleep enough, even your muscles shrink. So shorter sleep is shorter life. Remember that one thing. Shorter sleep is shorter life. Also, if you burn the candle on both ends, that means, you're sleeping late because of partying or whatever reason you're sleeping late and you're getting up early, then if you burn the candles on both ends, it also creates havoc in your immune system. And besides all of this, drowsy driving can cause accidents. Drowsy driving is worse than alcohol. Like somebody has is above the speed limit, about the normal level that we can do. Drunk driving. Drowsy driving is worse than drunk driving. Also, if you don't sleep enough, what happens is that, you get other problems also, depression, lung problems, have almost every system in your body is affected. Just remember that. Okay. And it's not only that the old guys cannot sleep, even the kids cannot sleep sometimes. You know, my grandkid had a slumber party and one of his friends was snoring. Next morning when he woke up, I asked him to open his mouth and he had big tonsils. So I told when his dad came to pick him up, I told him that, your son has tonsils, take him to an EMT doctor, and they removed his tonsils. And the next time when he came here, he was happy. In fact, he was suffering from ADD, the attention deficit syndrome. Okay. And that even stopped, even that improved considerably after just removing the tonsils. So remember something, it's not just the old people or the obese people who have it. Sure, they have it more, but so you cannot hit the snooze button if you have this obstructive sleep apnea, OSA. So I wanted to kind of bring that in at this point because what happens is you got prolonged hypoxia. Hypoxia meaning low oxygen, and your carbon dioxide increases because you're not breathing. So that is called hypercapnia. So these words are important because you just can know that this metabolic dysfunction can cause changes in your DNA. And it can also cause sympathetic nervous system problems, diabetes, stroke, and everything else. So this is why you can have psychological problems, cardiovascular problems like hypertension, chronic heart failure, coronary artery disease, atrial fibrillation. All these problems can occur just because of insufficient sleep. So that is the important thing. Now, one other thing is whenever we talk about sleep, we talk about the circadian rhythm. A circadian rhythm, what happens is if there is a disruption of the circadian rhythm, then you have low energy, low mood, reduced immune function, and decreased concentration. And that commonly happens in present day because of jet lag, shift work. I remember when I was working in the emergency room, it was late nights, like in the night we were working in the emergency room, night shift, late night activities. Because of that, the shift work, my sleep was disrupted because the circadian rhythm was disrupted. In fact, I quit the emergency room, a high paying job at that time when I first came back here, back in the 70s, in the early 70s when I first came here, and then moved into something a little bit better, That's the reason, okay? So if you all have any questions, you all are free to ask me because while we have these pretty pictures here, I can answer them easily. You can just raise your hand and I'll be happy to answer any questions while we are going on so that, we can talk about this right away, okay? So I want you to understand what is going on so that it will be useful for you and it'll most of the time, it will help you to sleep better, okay? Now, we've talked about this alternate nostril breathing all the time. It's a very, very simple thing. The simplest way to do it is you breathe in from breathe in through your right nostril, hold at the end of the peak, and then breathe out through the left nostril. So that is the simplest way to do Anulom Vilom. But then if you want to add something to it, then you need to hold your breath. So this picture here, this little inverted triangle. So you breathe in and then you hold your breath. That is called hold your breath, called inhale hold. This is the inhale hold is Antara Kumbhak. And then you breathe out. Okay. So that is, we talk about that in yoga all the time. You breathe in, then you hold your breath in Antara Kumbhak and you breathe out and then you breathe in again. And then you hold your breath again. That is called inhale hold and you breathe out. So this is but modern medicine is saying that this is useful, but more important than inhale hold is Antara Kumbhak. Number 2 is number 4, exhale hold. So exhale hold is more important, and this is why when we do box breathing, it comes into picture. So this is also based on yoga, but modern medicine has emphasized this box breathing more than anything else. Okay? So what happens is you have to visualize a square. Okay, so visualize a square, okay, and then, okay, so let's go back here. So now this is the mechanics of breathing. So breathe in, you can do this with me, then hold, and then breathe out, and then hold. Now, when you hold this exhale hold, the nitric oxide and carbon dioxide is accumulated here. And then when you breathe in that part, that's why the exhale hold is better. So this is the mechanics of breathing. And this is very important to know because even Navy SEALs use this. Navy SEALs are taught how to cultivate the mind so that they can focus for ultimate attention and balance of effort and recovery. Navy SEALs are taught this. Olympic athletes are taught how to do this, So there is importance of doing this square breathing. Now, many times when I take a class during this breathing, what happens is people have difficulty to do that exhale hold. So a simpler method to do exhale hold is called an intentional breath hold. And Patrick McKeown, he talked about this extensively in his book called The Oxygen Advantage. This is breathing techniques for health and fitness. So this is also fitness for athletes and for everyone, for all of us, not just athletes. So let's do this with me. Go ahead and follow me. So take a small breath in, small breath out, and now hold your breath. And at the first sign of hunger, you breathe in. So it's not a question of, you're trying to keep your breath longer than me or anybody else, But this control process, each person is different. So when you have this feeling that you have an air hunger, then you breathe. So it appears to be counterintuitive because mostly we tell people, hey, breathe, But this holding the breath, the body compensates to maintain proper function of vital organs. The body compensates to maintain proper function of vital organs. So this is extremely important. So, you breathe in, breathe out, and you hold your breath. This is a way to do the intentional breathing. Okay. You can even pinch your nose to hold your breath. That is okay, or just hold your breath, whatever way. And this increases the parasympathetic system, the vagal tone, and the nitric oxide. We'll talk about the nitric oxide in a little bit when we talk about Brahmari. Okay. And this calms the nervous system down. Very good. It helps you to reset. So this is called the intentional breath hold. Remember this little thing here. And to hammer the point a little more, I want to tell you this. Breathe light to breathe right. So it is a subtle, imperceptible breathing. The person standing next to me should not be hearing my breathing. So it's not a big that type of breath. Many times during yoga classes, we only for demonstration we do this, but it should be a subtle, imperceptible breath. Okay, so efficient breathing at rest improves breathing during exercise and sleep. So if you're thinking of running or 200 meters, 400 meters, or whatever you're trying to do this efficient breathing at rest, and that will improve your breathing during exercise and sleep. So Buteyko talked about this. Buteyko is a Russian scientist. He's a pulmonologist, and he treated hundreds and thousands of patients for asthma, rhinitis, and snoring. And Patrick McKeown learned this technique under Buteyko, and he wrote this book called Oxygen Advantage. And he, of course, talks extensively of this technique to breathe light, to breathe right. Okay. So do not tense your body. Okay. So if you have tension, then you have problems. So, smile, then you won't have any tension. At least you can smile in the night, smile to yourself. And then light nasal breathing increases the nitric oxide concentration from the paranasal sinuses. So this is what I want to do. So what else does this do? It also increases the vagal tone, which is the parasympathetic system. Remember, the whole purpose of yoga is to downregulate your sympathetic activity and upregulate your parasympathetic activity. Yes? So your eyes are closed. So here also, inhale calmness, peace, and ease, and release stress and disease. Okay. So that's how. So we'll talk a little bit more about progressive muscle relaxation when we talk about yoga nidra. So this is what the main purpose of this slide is, to tell you to improve your parasympathetic system, the vagus system, vagal tone. 80% of parasympathetic nervous system is vagal tone. Okay, so that's important. And by increasing the vagus tone, you're decreasing your blood pressure, decreasing your respiratory rate, your cortisol, which is the stress hormone, adrenaline, noradrenaline, all of that. So cortisol, noradrenaline, adrenaline is more for sympathetic system, the fight and flight. So you want rest and digest. Rest, digest, repair, regeneration, recuperation, all of that. So slow breathing activates the hypothalamus, which is in the brain, right? The hypothalamus is the brain within the brain. And that is connected to the pituitary gland. There's a master gland. And that sends out neurohormones that inhibit stress, these stress hormones like cortisol, adrenaline, and noradrenaline. Remember, and then that triggers the relaxation response. By decreasing all of these, that triggers the relaxation response. In other words, by increasing the parasympathetic tone, you're creating a relaxation response. See, other relaxation techniques is deep breathing, Tai Chi, all of those things, biofeedback mechanism, the music therapy and aromatherapy, all of those things help a little bit here and there. But simple methods of relaxation breathing is the most important thing that you need to do. You know, nature walks, physical activity, all these things help. But this is the most important thing. And so what is this vagus nerve? Here, this is a pretty picture of the 10th cranial nerve. So it's the 10th cranial nerve. There are 12 cranial nerves. And vagus nerve is the longest cranial nerve, and it is the second longest nerve in your body, entire body. Okay, so this is the vagus nerve. And the vagus nerve, it releases acetylcholine. Just like in cortisol, you know, the sympathetic system, the cortisol, epinephrine, norepinephrine is released. Similarly, here it is. And this relaxes the blood vessels. Okay, and that decreases your blood pressure, decreases your heart rate, decreases your respiratory rate, all of that. It slows the heart rate down. So this is the important things about vagus nerve. All right, and this means prolonged exhalation. Remember we talked about it, proper breathing. It's a small inhalation and long exhalation. So the exhalation should be double the inhalation. Yeah. So this is why. Now, all these things this is evidence-based medicine. So it's not something that I'm talking about it from just, there are hundreds and hundreds of papers talking about the autonomic nervous system, which is the parasympathetic nervous system, and how it helps sleep. Okay. So I'm reading all these so that you don't have to read it. Okay. So I'm showing you all this, that this is in the Journal of Clinical Sleep Medicine. So there are papers all throughout my thing. Now, there's one thing about coherent breathing. So this is also The Healing Power of Breath is a beautiful book. I would strongly advise you to read this. It's by Richard Brown and Patricia Gerberg. They are neuroscientists and psychiatrists at Columbia University. And they talk that the ideal number of breaths is 5 breaths a minute. People breathe 3 times faster. So the way to do that 5 breaths is you take inhalation is 6 seconds, exhalation is 6 seconds, or you can do 4 for inhalation and 8 for exhalation, which is normally what I do. So it's 12 seconds. Basically, it's 12 seconds. So 60 divided by 12 is 5 breaths a minute. That's the way we do it. Coherent breathing. Okay. So this is why you need to be in the green zone. Okay. This is the book. So that also helps to lower your respiratory rate, increase your vagus tone, which we have been talking all about, the parasympathetic system, lower your heart rate. And that relaxation response, what happens is the GABA levels, the gamma aminobutyric acid, GABA levels are increased. So this is very important. And more than that, the cytokines which are linked to inflammation and stress, chronic inflammation and stress, cytokines are decreased. So this is extremely important. And there's a pretty picture here, which is like a seesaw. So if an animal, stress is important, and even, the sympathetic tone is important. So if an animal is chasing you, you need to be alert. You need this fight and flight. You can fight the animal or flight. You run. Okay. But after that animal is gone, then you need to chill out and go into the resting stage. So this is like a seesaw. And this is called self-regulation, cardiac coherence. And this is important for autonomic stability. So remember this coherence lowers your heart rate, breathing, anxiety, everything it does. Okay. And there are many, many papers on this. For example, evaluation of heart rate variability. So this also decreases your heart rate variability. If you can see that, we talked about heart rate variability right here in the lower part. So this is very important to understand this particular breathing is in Zen meditation, but there are many other yoga techniques that we do that talk about this thing here. Okay, so now we've talked about this. Now we come to Brahmari. Remember I talked to you about nitric oxide? So you can do this with me, inhale through the nose, and it's a prolonged exhalation with the throat from your throat. And you can also put your fingers here. You can release your ear flap. It's called the tragus, this cartilage here. And that can cause vibration, and it oscillates the airflow in the nostrils. This increases the nitric oxide by 15 times. Remember, there is no medicine that increases the nitric oxide that much. Nothing. Okay? So this is what happens. And what is the big deal about nitric oxide? Well, it maintains your overall health. Every system in your body is helped by nitric oxide. 3 people got a Nobel Prize for this nitric oxide discovery. In fact, nitric oxide is toxic in the environment, but in your body, it is the best thing that can happen to you because there are a lot of biological functions. It regulates your vascular tone. That means the endothelial lining of the thing. So it widens the endothelial lining, and that relaxes the smooth muscles lining the blood vessels. And that, what happens is there's increased blood flow to the organs, to the heart, liver, lung, brain, everything. And that will also decrease your blood pressure. So these are very, very important things. See, because the smooth muscles in the trachea, the bronchioles, they relax. The smooth muscle cells in the arteries dilate because they relax. And that helps your heart. So the nitric oxide is a neurotransmitter. It's in the brain, the spinal cord, and it regulates neuronal activity, memory, everything. So it is very important. And for wound healing also, it is very important because, it relaxes the arteries, so there's more blood coming into the wound healing, okay? So the other thing is, a ruffled mind makes a restless pillow. You all have heard about that. I mean, that's a very, very common thing. But you see here, this little cartoon says, I keep worrying about everything and I can't sleep. So he says, you can't sleep, count sheep. So the guy says, no, I'm worried about the price of wool. So this is what happens. You're worried about it. You're stressful. And so what is the big deal if you don't sleep? Well, it increases your metabolic problems. So you've got diabetes, stroke, heart disease, obesity, systemic inflammation, arthritis, concentration, all these things happen. And we talked a little bit about the glymphatic system earlier. So the glymphatic system is like a janitor. It removes the toxins. It removes the amyloid, the tau proteins, and all the toxins from your brain. And this happens when you sleep. So your glymphatic system is active when you sleep. And that janitorial service occurs when you sleep. So remember that. So there is a lot of muscle health challenges because people get up many times in the night, which is called nocturia, arthritis, diabetes, all these things happen. But remember one thing, that you need to chill out, and unwind your daily activities. This is especially important for elderly people. So at the end of the day, what is the message here? My summary slides, a couple of them are proper breathing causes relaxation response. And this makes you help your body to heal. So it's a muscle relaxation. We'll talk about that in a minute more. But this is what it condones. You can visualize the ocean. I swim a lot. I do a lot of swimming, so I like the ocean part, but you can think of whatever. And you don't want to have mental clutter. You got to have a peaceful mind. So it's not mindful, but mindful. Okay, so observe your breath, and that is very important to get the best results. You can think of a moonlit night, and remember poet Rumi, he said, be the stillness. Let the water settle, and you will see the moon and the stars mirrored in your own being. So he talked about that. He also talked about breath and body is one. So your breath connects your body and your mind. So mind and body is one, they're interconnected. And the breath is the string of the kite. And the kite can go in the past and the present. So this is what it happens. The other summary slide is that if you don't snooze, you lose. That means you need to sleep. But because of timetable schedules and all kinds of things, people are not having downtime, especially children. They need free play. Don't be a busy bee, and nowadays they talk about FOMO, the fear of missing out. So they want to do everything, places to go, things to do, people to meet, time to beat, but you need to let go and dissolve the ego. So this is the most important thing, right? People have to go to Pilates and here, there, everything, that's fine. But have some downtime. That is the most important thing. And the last topic here is Yoga Nidra. So I want to tie down all the modern medicine to what we've been doing all along. Yoga Nidra is the thing that we need. It's called yogic sleep. And there are several stages in the yogic sleep, and we've discussed this in another setting. But main thing that I want you to be is bring the awareness back to the breath, the body, and then the external environment. So you got to go through this cycle and then bring awareness back. So you need to turn inwards. Remember that. So these are the few cycles, the thing. We take a sankalpa, the body rotation, that is called progressive muscle relaxation. And the next slide, I'll show you a little bit about that. And the breath awareness, what we've been talking all about it. So this is really a summary of what we have talked about all this time, but it brings in the yoga nidra, the yogic sleep. The progressive muscle relaxation that we've alluded to before is it improves your sleep. From a restless night, you can become a restful night. This is the key, and this decreases your tension, alleviates your tension, headache, backache, all of that by calm body and mind. Okay, so this is the thing. So with this progressive muscle relaxation, you tense your body and then completely relax. That brings body awareness. And that helps to sleep, even for people who have insomnia and bad health problems, disability, all of that. This practice helps to do this regularly. And you can do guided recordings. We do that all the time. And this is very, very simple method to do this. Now, this is also based on modern medicine. They talk about this. This is evidence-based complementary medicine. So there is a synergy of medicine and yoga here. We're talking about it. And this helps to reduce stress, enhance your relaxation response, and improve your oral health. Okay? So are there any questions? I can answer any questions, or we can talk about sleep apnea, because this is one of the biggest problems that modern medicine is seeing, that people are not breathing properly because they have disordered breathing problem. They are snoring, disordered, SDB, sleep disordered breathing. And this can be because of obstructive apnea, sleep apnea. See that there? So instead of this going right through, the breath going right through, like in the light blue, you see this little circle here, it is blocked. And that is called airway obstruction. And then there is sleep apnea. That means there's no breathing for 10 seconds, apnea. And that can cause problems.